Good afternoon, ladies and gentlemen. This is Robert Chappell, Executive Editor, Madison365, with your daily update for November 18th, 2020. It'll be a brief update today. I have a seminar at 3:30, but I didn't want to wait until this evening to come to you because the news today is kind of important. So if you do have any questions about the data, about COVID, about the orders, about anything, drop them into the comments early, and we'll get to them before 3:30. But I just want to run through the numbers for you for today, which are not number of cases is a bad number. Again, you never want to put too much weight on a single day of data for anything. However, when you have fewer tests and more cases in any given day, it's worth noting. We actually had about 20,000 tests today, which is a pretty good number. We like to be above, in that 20,000 or more range of tests. Yesterday we had 22,000. Okay, that's not a huge drop off. 2,000 fewer tests, not a big deal. We're still over 20,000 tests. Here's the problem. Yesterday we had 7,090 new cases, which anytime over 7,000 is a lot. But you can kind of say, okay, more testing yesterday, 22,000 tests. You're going to catch more confirmed cases. Okay, fine. Today, 2,000 fewer tests, but almost 1,000 more cases. We broke another record today in the number of cases. Excuse me. 7,989 new cases today, just shy of 8,000 new cases reported just today. That's the daily positive test rate. Just for today, 40% of those tests that were reported today were positive. Again, these are tests that are reported today. These are tests that actually have been administered and processed over the past 4 days, and the state does allocate them to those days. So if you look at the state data, it looks like today is a lot lower than 7,900, but that's because there's only a certain number of cases that are, technically processed today, but they'll add 2,000 to yesterday and 1,000 the day before yesterday and stuff like that. But it's still the case that we have almost 8,000 cases today that we didn't know about yesterday. About 40% of those tests, 39.7, basically 40% of those tests were positive, which is an absurdly high number. That puts our total cases ever at 331,810, of which, and this has been consistent, about 22% of all the cases we've ever had are currently active. And what that translates to 74,600 cases currently active and contagious that we know about. Right? There are a whole bunch more cases out there that we don't know about yet that are just getting tested today, that will get reported tomorrow, the next day. But right now we know that almost 75,000 cases have been just diagnosed in the past 30 days and are still active. Our 7-day average of cases went up a little bit to 6,408. That seems lower than it should be, considering that we've had, almost 8,000 today, over 7,000 yesterday, 7,700 a few days ago on the 13th. But remember, we did have a couple of days of lower testing over the weekend, and therefore lower numbers of raw numbers of cases. But still, 6,408 is quite a lot. We also reported 52 more deaths today. Yesterday we had 92. Today we had 52. That's 144 in 2 days. That brings our average of deaths per day to 48. It was 49 yesterday. It is 48 today. Not a meaningful difference. Let's talk about where those deaths occurred. They are a little bit concentrated today. 11 in Milwaukee County and 7 in Marathon County. Marathon County's had quite a few. They've had several days of 4 and 5 fatalities. Today they have 7. Winnebago and Dodge counties each have 5. 4 were reported in Dane County to the state. Dane County itself actually reported 5 this morning because there was one yesterday that the state reported that the county didn't report. And then there are 4 today that both the county and the state are reporting. So it's 5 total for Dane County that Dane County reported this morning, which is the highest Dane County has ever reported in a single day. Burnett County, Brown County both had 2. And then the following counties each reported 1 death today. Wood, Waukesha, St. Croix, Sauk, Racine, Portage, Pierce, Ozaukee, Outagamie, Kenosha, Juneau, Forest, Eau Claire, Dunn, Chippewa, Buffalo, and Barron. And actually, I was wrong. There were 53 deaths reported today, but there was 1 death in Langlade County that was taken out of the data. That was like reclassified for whatever reason. So we had 53 deaths, but our total death toll and our daily average, for purposes of our daily average and stuff, our total count went up by 52. Which brings our total count to 2,793. So tomorrow we will pass 2,800 deaths. And at this rate, we will pass 3,000 deaths, by next week, Monday or Tuesday, most likely. What else can I tell you? I think that's pretty much the gist of the numbers today. The 7-day positive test rate. I'm sorry, I skipped over this. I'm not sure how this works exactly. This math doesn't make a lot of sense to me, though I trust the state is reporting this correctly. I haven't really had a minute to really dig into why this happened, but we had a positive test rate of 40% today just for the day. But even so, the 7-day positive test rate actually went down to 34.7, which is still really high. That has gone down though over the last 2 days. So that's not a sigh of relief yet. Not really even reason for optimism yet. But any day that it doesn't go up is a slight glimmer of hope that it's not completely crushed yet. Now, we did hear, unfortunately, I was in meetings for much of the day, so I did not hear the governor's briefing for myself, although I'm following some reporting on it. And we don't have updated hospital statistics until 3:30, so I won't be able to get those to you right now. But we do know that the Department of Health Services Secretary designee Andrea Palm has said that 1/3 of Wisconsin hospitals have a critical staffing shortage. We talk about the number of beds that are available because that's the data that we have easy access to. The number of beds available is not the only consideration, right? You also have staff. A bed by itself with no nurses and no EVS staff and no physicians is just a bed. Right? It can't actually be used to treat anybody. So staffing is a big issue. 1/3 of hospitals are having critical staffing shortages. Andrea Palm, the DHS secretary, said that there's at least one region of the state where the ICU beds are now at 0. Unfortunately, the Wisconsin Hospital Association does not have that data updated yet until 3:30. So I don't know which region that is. Probably the Northeast or North Central. Those are the ones that were in lowest count yesterday. But the bottom line is hospitals are in tough shape right now. Like we're getting to the point. What I can probably tell you though is the population at the alternative care facility If you'll give me just a moment. So in light of all this, Governor Tony Evers has issued another emergency order, which will probably be challenged in court. But basically what it does is extends the mask mandate, which was set to expire on November 21st, which is Monday. No, not even Monday, Saturday. It was going to expire Saturday. He's going to extend that into January. That mandate is under review right now by the Supreme Court. Oral arguments were made on Monday. And they'll issue a decision on that very soon. In the alternative care facility, there are currently 22 patients. Yesterday there were 19. So that is still not close to full. I mean, it's built for 500 people. I don't know what the staffing levels are there right now, so I don't know if that is going to overburden staff yet or not. I doubt it. I think they probably have it staffed pretty well. But the fact is that that number has steadily gone up over the past 2 weeks, past 3 weeks, I guess. And what that indicates is that there are hospitals that needed the room and removed 22 patients from their hospital before they're ready to be discharged to home. So they had to send them to this alternative care facility to complete the recovery, which is, it's just kind of bad news. The governor again, the legislature rather, has said that they'll probably wait until January to take up COVID-19 relief, which is the sort of the most the Republican legislature is going to do. And that's, 2 months away, which the governor doesn't like. And a reminder that yesterday, the Dane County issued an order banning all indoor gatherings and limiting outdoor gatherings to 10 people. The state's not going to follow suit on that. I don't know if other counties will. I know New York City is closing schools. Minnesota is moving to lock down things statewide. Iowa, the governor of Iowa issued a mask mandate. Ohio is moving toward restrictions. Rock County has rolled back to phase 1. I'm not sure what all the details are, but basically limiting capacity in retail and restaurants. Everybody around us is scaling back, shutting down, trying to get people to stay home. And in the meantime, we are extending a mask mandate, I guess, but that's it. One other non-COVID piece of news before I go. 2 things real quick. First of all, the Trump campaign has paid $3 million to the Wisconsin Elections Commission to pay for a recount of all the votes in Dane County and Milwaukee County, the 2 most heavily Democratic counties, and not coincidentally, the 2 counties with the highest Black and Latino population. Scott McDonald, the clerk here in Dane County, has said that they will begin the recount on Friday and continue until it's complete. And the other piece of news, I'll just let you know, this is kind of an insider news for us, but I hope you'll join us tomorrow. We have, I've said this many times on here that we are a nonprofit newsroom and that we rely on your donations to go on. And most of your donations, most of all the money we bring in, honestly, goes to pay people to do journalism. And I want you to meet some of those people. So we have editorial team staff meetings every Tuesday at 2:30 and every Thursday morning at 9. That's where we talk through the stories that are being worked on, figure out, what they need and when they are going to come in, when they need to be in. We toss around ideas for news stories. We hand out assignments. And that's kind of how the whole news operation works, is from these meetings. And I hope you'll join us for them. We're actually, since we're doing them all online anyway, it's a very simple thing to take that Zoom meeting and broadcast it on Facebook Live, just like I'm doing right now. So we're going to do that tomorrow. We're going to have a 9 o'clock staff meeting. Honestly, if it's a normal staff meeting, it'll be like 9:05 because that's how we do it. There's always 1 or 2 people that are a little stragglers, usually me. But we're going to broadcast that meeting, and we're going to invite you into it and let you get a little behind the scenes look of how we do it, how we think about our stories, how we talk about them, and you'll be able to see visually. I'll show you my little tool that I use. You'll be able to see visually how many balls we have in the air at any one time. It's kind of a lot. I think you'll be surprised. And you get to meet some of those folks. And some of the names that you see on Madison365 all the time, some of the voices you hear on the podcast, you get to see them and kind of connect the face with the name. So I think that'll be fun. So I hope you just watch for that. It'll just pop up in your Facebook Live or your YouTube, your Periscope tomorrow morning around 9 o'clock. So that is all I have for you today. In the meantime, if you do want to lend us some support, it's Madison365.org/donate. Until tomorrow, I appreciate you being with me for a few minutes. I'm sorry about the brevity today, but I do appreciate your attention and your time. And we will see you tomorrow.
This is 365 Media.